Hi, everybody. I wanted to hop on here and talk about something that I have been thinking a little bit about recently, probably because I was on labor and delivery call earlier this week. I got called to a patient's room to put in a labor epidural, which is not uncommon because I'm an anesthesiologist. And as I was consenting her for the epidural, she said to me, do you think I should be getting the epidural? I'm only 2 centimeters dilated. My friend told me that she didn't need to get hers until she was 5 centimeters dilated. And I feel like maybe I'm too early in labor and I shouldn't get it. What do you think? And I get asked this question all the time. As an anesthesiologist and a mother of 4, I obviously have vast professional and personal experience in this topic, and women do ask me this all the time. So I would like to talk about that a little bit. I'm going to make 3 big points in this video, and the first one is that the most important thing is not to compare your labor to somebody else's labor. When you get your epidural might be very different from when your friend did. The second thing to know is that there's no ideal dilation to get your epidural at. It's very dependent on how the labor progresses. And the third point that I'm going to make is that if you do kind of have the ability to determine when you want to get your epidural because you either have a long labor or you are being induced and you're at the hospital from the get-go, I'll talk a little bit about what kinds of things to think about as far as when to get the epidural. So the first point I want to make is don't compare yourself to anybody else. Every labor and every delivery is different. So there are so many things that affect the pain that somebody feels during labor. Medically related things would include if you're being induced for your labor, if you have a short labor versus a long labor, and even the way the baby is positioned in the birth canal. So these things will play into how much pain you feel, where you feel the pain, how tolerable the pain is, and they can play into whether or not you get your epidural earlier or later. We see this very frequently on labor and delivery. I will have women who are delivering, their second or third child, and they had their previous children naturally, or they were able to not get an epidural until very late in their labor, and then they get induced with a subsequent labor, and they will very often say, wow, this induction is a totally different ballgame than my spontaneous labor. So I think it just really goes to show that you can't compare one labor to another. And I can attest to that. I have 4 kids. Every labor was totally different. And I got my epidurals at different times for every child. So you really don't go by what your friend said or what you've read on different websites or mommy blogs. You as an individual have a pain tolerance that you know what's tolerable for you and what isn't. Your labor is going to play out differently than my labors did or somebody else's labor does. So you can't compare one person or one labor to another one and say, well, I got my epidural at 5 centimeters last time, so I'm going to wait till 5 centimeters this time, or my friend was able to go without an epidural, I'm going to do the same thing. You just don't know what you're going to experience during labor to be able to say ahead of time when you are or aren't going to get your epidural. So I think the best thing to do is just to go into it with an open mind and determine, during the labor process, when you feel uncomfortable enough to get the epidural. And I'll talk about that a little bit more in the third point. So, key point, do not compare your labor. Decide for yourself during your labor when you're at that point where you feel like you need pain control. Okay, so the second thing I want to address is how dilated should I be before I get the epidural? I hear this as a frequent question as well. Long ago, before I was a physician, they used to say that you had to be 4 centimeters dilated in order to get your epidural. And my understanding is the belief is that they wanted patients to be in active labor. And I will tell you that that is no longer a thing. We don't require patients to be a certain amount dilated in order to get their epidurals. We just require that they are in labor and they are going to have a baby during that hospitalization. And the reason for that is that we don't want to do an additional procedure on a patient that ends up going home and not having the baby. So I have put epidurals in women who are being induced and they're 1 centimeter dilated. I have put epidurals in women who are 9 centimeters and very close to pushing. So really, whenever you feel like you're ready to get your epidural, that's the right time to get it. You don't have to be a certain amount dilated. The nurse will, obviously make sure that you're in labor, make sure that the OB is okay with the epidural going in, and then the anesthesiologist, as long as those requirements are checked, is happy to put the epidural in, assuming there's no contraindications. So you do not need to be a certain amount dilated. The third thing I want to talk about is just if you do have the decision because you have a long labor or you're being induced, when to get your epidural, kind of the signs to look for. And the first thing I'll say is that labor and delivery nurses are typically very experienced. They know how to guide patients as far as when to get their epidurals. But I tell patients that the ideal thing is that you don't have to be in a certain amount of pain, but certainly if you're getting to a point where you are uncomfortable to the point that you're breathing through your contractions and really huffing and puffing through them, having to think about them, getting to a point where it's pretty uncomfortable for you to sit still during the contractions, that's probably the point that you want to think about getting your epidural. When you get the epidural, you do have to be able to sit at the edge of the bed, and we do need you to be relatively still while we do it because we're using a needle to access that place in your back, and it's hard to do with a moving target. So when patients are starting to get so uncomfortable that they're moving around a lot, it makes it much more difficult for you as a patient to hold that position. And for the anesthesiologist, if you can hold the position, it's just much easier for the anesthesiologist. Now, don't think that if you come in at a lot more pain than that because you had a fast labor or something, that the anesthesiologist won't be able to do it. I assure you that the nurse and anesthesiologist are excellent at getting you through the procedure no matter where you are in your labor. But again, if you have the choice, it's definitely much easier for you as a patient and for the anesthesiologist and nurse to help you through the procedure if you're not so uncomfortable that it's difficult for you to sit still. So that's kind of the ideal point. I mean, again, I can't give you an exact number of dilation or an exact number on the pain scale, but really the things to look for are you having to breathe through your contractions and really concentrate on them? Are you in so much pain, or are your contractions coming fast enough that you're not getting a lot of relief between them? And if you'll be able to sit relatively still on the edge of the bed. So I hope, just kind of wrap up things to remember. Don't compare your labor to others. Every labor is individual. Even between the same person, every labor is different. Number 2, there is no amount dilated that you need to be in order to get your epidural. And number 3, if you can choose, it's at a place where you're still able to sit relatively still on the edge of the bed. So I hope this answers some of your questions about when to get an epidural during labor. If you have any more interest in learning more about this topic, I happen to have an entire course that I developed related to the topic of pain control during labor and delivery. It covers everything you could ever want to know about epidurals, anesthesia for C-sections, what's going to happen during the epidural placement, commonly asked questions, risks of the epidural, really everything you could ever want to know. So if you're interested in seeing that course, you can find it on my website at www.sarahrecmd.com and just click on courses and the course information will come up. Like I said, that will answer everything you ever wanted to know about epidurals. So I hope you found this helpful and have a great day.